With cases, hospitalizations, a positivity rate, and now a new Delta variant threatening our community, tackling vaccine hesitancy has never been more urgent. KQ2's Madeline McClain now speaking with a doctor with more than 4 decades of experience about how to convince more people to take their shots.
Despite doctors and public health officials' pleas, mountains of research, and millions of vaccine success stories, 4 out of 5 people in Buchanan County are unvaccinated.
I think we can still get there, but not without seeing morbidity and mortality that is completely vaccine preventable.
Dr. Marianne Jackson, the dean of UMKC Medical School with a background in vaccines and infectious disease research, says these vaccines are medical miracles.
In the future, we're going to say we hit on gold.
But fear, distress, politics plague conversations about them.
It's difficult for them to separate evidence-based information from misleading and false information.
For public health officials like St. Joseph Health Director Deborah Bradley, it complicates her job.
We've been trying to tell people they need to get vaccinated. We've been trying to share that it's safe, it's effective.
For months, she and her staff have been trying to bring the vaccine shots to people, from the mall to factories and the food kitchen, with only a fifth of them taking them up on the offer.
There's going to be a segment of this population, and it may be 10 to 15%, that frankly refuse no matter what.
Instead, we need to invest our time and energy in the more open-minded. So how do you save the skeptics? Communicate science, but simplify it.
For instance, when the blood clot issue came up and we paused J&J vaccine, putting that into context, that you would be more likely to be struck dead by lightning or be killed by a shark than, to have this rare side effect.
Analogies are great. So is showing people that they're in the driver's seat. For example, you can show them that it's a choice, a similar choice to not putting themselves or a family member or a child in a seatbelt.
As you vaccinate yourself, you're protecting those around you, including those who may not respond to vaccines.
Another strategy could be small businesses, government officials providing incentives. And if the carrot doesn't work, possibly the stick.
Mandated vaccines are becoming a strategy for getting healthcare workers vaccinated, to getting college students vaccinated, and they're not new.
Last but not least, the fifth of us who are vaccinated, sharing our stories.
If you've received your vaccine, share your story. Tell your neighbors, tell your friends, tell your coworkers, so that they can see that the vaccine has benefited you and not harmed you.
Reporting, Madeline McClain, KQ2 News.